Research has shown that there are specific diets that can definitely accelerate nerve repair. There are 5 factors that nerves need to regenerate, and those factors are: what if your next meal could heal your nerves or sabotage your recovery like a stealthy ninja? Okay, maybe not that dramatic, but close. Today, we're cutting through the bull to find the best diet for nerve healing. So, if you're ready to kick nerve pain to the curb and start feeling better faster, we'll show you exactly what to eat and what to avoid. And trust me, some of this might surprise you. So, grab your fork. Let's dive in. Welcome back, health warriors. If you watched any of our videos, you've heard us say time and again that nerves are the slowest healing tissues in the body, and it can take anywhere from 1 to 2 years for nerves to heal with the right tools. But here's the good news. You can speed up nerve healing with the right diet. Your diet affects everything in your body, not just your nerve health. It determines how fast you recover and how well you heal. So, today we're breaking down the top diets for nerve healing and figuring out which one gives you the biggest bang for your recovery. When it comes to nerve repair, these 5 factors are key for healing. Number 1, healthy fats. Healthy fats are your nerve's best friend, and they repair nerve membranes and the myelin sheath, which keeps signals firing fast and smooth. Without enough of them, you get signal distortion, resulting in nerve pain or burning and tingling. The second factor is the anti-inflammatory effect. Since chronic inflammation wrecks nerves, your diet has to be able to put out the fire. The third factor is nutrient density. Nerves need B vitamins, minerals, and antioxidants for regeneration. The fourth factor is blood sugar regulation. Now, I'm not just talking about diabetics here. 40% of the adult population is insulin resistant, and stable blood sugar is important for preventing further nerve damage. And the fifth factor is gut health. A healthy microbiome influences inflammation and nutrient absorption, both crucial for nerve healing. Okay, now let's talk about the contenders, and I'm talking about diet contenders because there are tons of diets claiming to be the best. But today, we're focusing on the heavy hitters. We're going to cover the carnivore diet, the healthy keto diet, the paleo diet, the AIP diet, and of course, one of the healthiest is the standard American diet, also known as the fast track to feeling terrible diet. Okay, just kidding. The SAD diet isn't a part of this video at all. I do want to say each of these diets has its strengths and weaknesses, and I've used all of these diets for my patients based on their individual needs and their medical profile. So remember, this isn't a showdown about which diet is the world's best. It's about which diet best supports nerve healing. So let's start with the paleo diet. Think of hunter-gatherer, not drive-through enthusiast. The paleo diet is all about real whole foods and zero processed junk, inspired by what our ancestors ate. Here's what's in the paleo diet: eggs, grass-fed lean meat, wild-caught fish, fruits, vegetables, nuts and seeds, and healthy fats. What's out are processed foods, grains like wheat, corn, rice, quinoa, beans, legumes, and most dairy are also excluded. Often paleo followers will allow for fermented dairy products like kefir or yogurt due to their enormous health benefits. And here's how paleo helps nerve healing. This diet is nutrient dense. It's packed with protein, B vitamins, magnesium, and zinc. All of these are crucial for nerve repair and growth of nerve tissues. It's also anti-inflammatory because it eliminates processed foods, and it's high in antioxidants, so it reduces chronic inflammation substantially. It's also rich in omega-3 fatty acids, imperative for the repair of nerve cells, and it balances your blood sugar levels. Next, let's examine the Autoimmune Protocol Diet, or AIP for short. AIP is like paleo on steroids. It's a more extreme elimination diet designed for people with autoimmune-driven nerve damage. So that would be conditions like multiple sclerosis, Guillain-Barré syndrome, myasthenia gravis, neuromyelitis optica, chronic inflammatory demyelinating polyneuropathy, or autoimmune encephalitis. This diet is also excellent for anyone else with any type of autoimmune diseases like rheumatoid arthritis, Hashimoto's, and even type 1 diabetes. Okay, let's look at what this diet includes. Here's what's in: grass-fed meats, wild-caught fish, healthy fats, fermented foods like kimchi or kombucha, bone broth, and fresh herbs. Here's what's out: all processed foods, grains, legumes, nuts, seeds, dairy, and nightshade vegetables, which include tomatoes, potatoes, eggplants, and peppers. So let's look at why legumes, nuts, and seeds are eliminated. These foods contain anti-nutrients like phytic acid and oxalates, which can interfere with nutrient absorption. The AIP elimination diet goes in phases, from the strictest elimination to a reintroduction phase in 90 days for certain foods. But no, it doesn't include a reintroduction of junk food. So that's out. Here's what makes AIP effective for nerve healing. It reduces inflammation by eliminating autoimmune triggers like dairy, grains, and the others that I've mentioned. This diet is nutrient dense, packed with protein, B vitamins, omega-3s, and antioxidants. It promotes gut healing and restores the gut microbiome, which will reduce significant inflammation. And it stabilizes the immune reaction, preventing further nerve damage. Now, let's look at the healthy keto diet. This is a low-carb, high-fat diet focused on food quality. The goal? Ketosis, where your body burns fat instead of glucose for fuel. The reason this is preferable for nerve repair and healing is that ketones provide more fuel for nerve cells than glucose does. Ketones produce far less free radicals than glucose, resulting in lower oxidative stress, not to mention that ketones reduce neuroinflammation, the inflammation around your nerves. Here's what's in with the keto diet. 70 to 80% of healthy fats, like grass-fed butter, ghee, tallow, or lard, along with extra virgin olive oil and coconut oil. It also includes 15 to 25% protein in the form of grass-fed meats or pasture-raised poultry and eggs and wild-caught fish. And it includes 10% low-carb veggies and fruits. What's out are grains, sugar, high-carb foods, and all processed food. This is how healthy keto helps with nerve healing. It's neuroprotective, meaning the ketones lower inflammation and provides better energy for nerve cells to repair and regenerate. The healthy keto diet also improves mitochondrial health and recovery. And this diet provides blood sugar stability, preventing glucose-related nerve damage. Well, we got a lot of visitors today. I guess that means it's time we address the elephant in the room. Okay, there's a common concern with nuts, seeds, and even some vegetables that are allowed in the healthy keto diet. And that's because of the anti-nutrients that they contain. So you might have heard of oxalates and phytic acid, compounds found in plants, seeds, and nuts that can block nutrient absorption and even irritate the gut. So should you swear off nuts and seeds forever? Not necessarily. There is a workaround to eliminate the anti-nutrients and get just the plain health benefits that these foods offer. So the first thing you can do is soaking. Soaking nuts and seeds for anywhere between 2 to 12 hours, depending upon the type of nut, will break down these anti-nutrients. You can do a Google search to find out how long you need to soak your nut, depending upon the type of nut you have. Now, another method is sprouting, because sprouting breaks down the anti-nutrients. It also increases the bioavailability of the nutrients. Fermentation. So fermenting vegetables is a great way to break down the anti-nutrients, leaving behind an easily digestible food, even for the sensitive gut loaded with tons of nutrients. Now, you do want to skip roasted nuts and seeds. Although this does reduce anti-nutrients, it also destroys many beneficial compounds, so it's not the best approach. By preparing nuts and seeds the right way, you get the health benefits without the downside of the anti-nutrients interfering with your body's ability to absorb key minerals like magnesium, zinc, and calcium. And these are nutrients essential for nerve repair. The bottom line, if you're following a healthy keto, AIP, or paleo approach, be mindful of how you prepare these foods so you can maximize their benefits while minimizing potential harm. The last diet we'll look at today is the carnivore diet. This is an all-meat diet. No plants, no carbs, just meat, eggs, and animal fats. It's also commonly used for people with severe gut health issues like IBS, Crohn's, ulcerative colitis, or celiac disease. It can also help people with obesity, insulin resistance, and type 2 diabetes. So, what's in on this diet? Beef, lamb, pork, poultry, fish, eggs, butter, bone broth, those are the key nutrients. What's out? Everything else. Fruits, veggies, grains, nuts, and seeds. So the carnivore diet falls dreadfully short for nerve healing for these reasons. Number one, it's nutrient deficient. It lacks B1, B6, vitamin C, magnesium, and potassium, all of which are crucial for nerve health and regeneration. It also raises the risk of inflammation because it's lacking in substantial antioxidants, which you can get from vegetables and from eating fruits. So this can increase oxidative stress, resulting in more nerve damage. And with little to no antioxidants, forget it. You lose nature's inflammation fighters. It can also lead to an omega-6 overload. If you're eating mostly grain-fed meats, conventionally raised poultry, and eggs, your omega-6 can skyrocket. But to be fair, this diet isn't all bad. It's just not the best choice for nerve recovery. So, how is the carnivore diet best used? If you have significant GI disorders and can't digest vegetables, this diet can be useful for the short-term duration. So that would be something like 1 to 3 months. And that's going to help rapidly reduce inflammation and promote gut healing. However, it's not ideal for long-term use because it can cause critical nutrient deficiencies. If you're on the carnivore diet for 6 months or longer, you'll need careful supplementation of critical nutrients to prevent deficiencies. Even Dr. Paul Saladino, carnivore diet's biggest champion, has evolved his stance because science evolves, and so should your diet. If you want faster nerve healing, lower inflammation, and complete recovery, your best bet isn't extreme. It's balanced. So, which diet wins for nerve healing? The final verdict is, well, health warriors, we have a tie between healthy keto and the AIP diet. These two diets provide the best combination of nerve supportive fats, anti-inflammatory foods, and nutrient density. So here's how I choose between the two for my patients. Any patient with any form of an autoimmune reaction or disease gets placed on the AIP diet. Patients on many medications, indicating a lot of systemic dysfunction in multiple systems or with significant mitochondrial damage or even severe unrelenting symptoms get placed on the AIP diet. Any patient suffering from toxicity-induced neuropathy, like you'll get with chemotherapy, with exposure to molds, alcohol abuse, or exposure to heavy metals, gets placed on the AIP diet. Patients with gut-related disorders like SIBO or leaky gut get placed on the AIP diet. Any patient who is insulin resistant, overweight, or obese, or who suffers from fatty liver, high blood pressure, or high cholesterol gets placed on the healthy keto diet. Any patient whose HDL, and that's the good cholesterol, if their HDL is below 60, they get placed on healthy keto. And the paleo diet, I use more as a transitional diet when people have made significant recovery and they would like a healthy diet with less restrictions. All right, health warriors, we've covered a lot today, from prehistoric paleo feasts to the high-fat magic of keto and the meat-only madness of carnivore. But here's the bottom line. Your nerves are only as strong as the fuel you give them. If you want faster healing, better function, and less pain, you need a diet that works with your body, not against it. So ditch the junk Embrace the right foods and give your nerves the support they deserve. And remember, no extreme diet is a magic bullet. The best approach is a balanced, nutrient-dense plan that works for your body. Now, if you found this video helpful or at least mildly entertaining, do me a favor and hit that like button because your nerves will thank you. Be sure to subscribe so you don't miss the next nerve healing deep dive. And don't forget to tap that notification bell because YouTube loves keeping secrets. And if you've got questions, please make sure to drop them in the comments. I love hearing from you guys. Until next time, health warriors, stay strong and keep those nerves firing on all cylinders. I look forward to seeing you on the road to great nerve health. Blessings. These foods contain, you gonna help Mama? Hi, sweetness. I don't think he's ever done that before. You can do a Google search. You can do a Google. Okay.